Hidalgo County, located on the southern tip of Texas along the border with Mexico, is one of the poorest regions in the country, according to U.S. Census figures. With sprawling cities like McAllen and Edinburgh, Hidalgo County also has 33.5% of its residents living in poverty and is one of the highest uninsured counties in the state of Texas. Nuestra Clínica del Valle, a federally qualified health center, has been serving low-income and uninsured families of Hidalgo and Stark counties in the lower Rio Grande Valley for the past 45 years, including Maria Martinez and her husband, Jose Martinez.
Yo estoy bien contenta con eso, con toda la ayuda que aquí nos da. Hay de todo aquí. En la Clínica del Valle nos ayudan para todo.
Maria, who suffers from complications from diabetes, and Jose, who has limited vision due to an eye condition, depend on the healthcare services they receive at Nuestra Clínica del Valle.
Yo por mi enfermedad, que pues ese no se quita, más se controla, la diabetes. Entonces, mi temor sería de que yo dejara de ver, que no me pudiera mover, que Dios no lo quiera me lleguen a quitar un miembro de mi cuerpo, no pueda salir a mis mandados, ver mis hijos que todavía los tengo. Ese es mi temor para mí.
Mi temor sería checar mi vista, lo que más me interesa, tener cobertura médica, porque a veces se necesita, a veces una emergencia, no vamos a poder pagar eso.
Elia Benavides has been a patient of Nuestra Clínica del Valle for 8 years. She has diabetes. Since 2014, Elia has been able to afford health insurance through the help of the Affordable Care Act, known as ObamaCare.
If I wouldn't have the insurance, I would pay a lot more, and I was afraid that I couldn't be able to pay a lot more money. I was thinking to go to Reynosa, and because I thought it's going to be very, very, very expensive.
With the initial launch of the Affordable Care Act and its healthcare.gov website on October 1st, 2013, Nuestra Clínica del Valle has helped enroll over 11,000 individuals.
Que vengan sin temor y que se asesoren aquí. Hay gente muy amable y le pueden asesorar cómo checarse, ver cómo puede agarrar la cobertura ObamaCare aquí. Hay muchas ayudas. Si tienen temor a venir, aquí pregunten.
Rachel Vargas, a certified application counselor for Nuestra Clínica del Valle, helps individuals understand their health insurance options by guiding them through the enrollment process using the healthcare.gov website.
I've had many people here come in with cancers, diabetes, or real bad. I had one gentleman come in. He was about to lose his leg. He showed me his leg. It was purple. I said, sir, let me help you. As soon as I did the application, he was eligible. He was only going to pay $7 for the insurance.
So, ¿ustedes no lo entendían como los deducibles?
No, nada de eso. This is an example that I use because they say, why do I have to have insurance? And I tell them, okay, I'm going to use the car as an example. The car, why do you get insurance for the car? Why do you get liability? Because it's a law. There you go. This is a law too. We have to do this until they change it. So then they understand that part. It's like I say, you are more important than your car. You're a person. If you get sick, what are you going to do? What are you going to do?
2017 will be a critical year for health centers. The 115th Congress has just begun, and already fundamental changes to the healthcare system are being debated that could greatly impact the work of health centers and limit affordable access to healthcare services for low-income and uninsured individuals. Congress is planning to repeal major provisions of the Affordable Care Act and make significant changes to Medicaid, all while needing to address a looming 70% cut to the health centers program before funding expires on September 30th, 2017.
Ay, pues me da bastante tristeza. Bueno, una por mí, otra por tanta gente que se ha beneficiado. Entre ellos, mi familia, mis hijas, 2 hijas que se han beneficiado bastante de este aseguro, de que a una de ellas la habían detectado de cáncer y que si no hubiera tenido ese aseguro, yo creo que no sé qué hubiera pasado con ella.
En realidad estamos viviendo en un tiempo
muy difícil, de que hay muchas enfermedades y pues ¿quién dice no estoy enferma ahorita, verdad?
Yo no, en realidad no sabía que tenía cáncer, sino que asistí nomás al hospital por un dolor que tenía. Entonces cuando presentamos el aseguro en la emergencia, en el hospital no batallé para que me hicieran los estudios necesarios para detectar el cáncer que tenía. Entonces de esa manera me ayudó mucho. Pues yo les tengo un mensaje de que se pongan en lugar de la gente que es pobre y que necesita el servicio de ObamaCare y que pues que no lo quiten, que pueden implementar otros aseguros, pero la gente se va a ir con el que es más barato.